This gentleman is sitting in a wheelchair.
Okay. How long has it been going on?
There is reasonably normal facial expression
6 months.
and
Okay.
absence of
Describe
tremor.
it to me. What is actually the problem? Describe it a little bit more in details.
The walking could not start.
Could not start. What happened when you start? If you can't get start, what happened?
What happened?
If you're able to start, are you able to continue walking?
Once I started, I can continue, yes.
Okay. Okay. Do you have falls? Have you been falling?
1 year ago, yes.
Okay. Do you fall forward or backwards?
Forward.
Forward.
Because I want to jump up.
Yeah.
And my right hand, my right leg could not
Yeah.
pick up high enough.
Okay. Okay. Now say the month for me, please, from January.
January, February, March, April, May, June, July, August, September, October, November, December.
Okay. Can you run back?
He's able to carry out
December.
fairly normal, rapid finger tapping movements, open, close movements of his hands, supination, pronation movements of his hand on his thigh.
With your right hand, can you tap like this for me? Big movement, okay? Open and close your hand. Okay. Can you do like this for me, please? Now try to...
Heel tapping movements are also relatively
On the other
brisk
side,
bilaterally.
You never have... Are you able to stand up, please? With your arms folded. Yep.
He's able to get up from a chair with minimal difficulty with his arms crossed over his chest.
Now when you start...
However, his gait is
Okay.
significantly abnormal.
Okay.
Stride length is very short, very tentative. Gait is shuffling with reduced elevation of his feet from the floor. And there is also an occasional freezing of gait.
Okay, what about if you count 1, 2, 3, start? Does it help if you count 1, 2, 3? Yeah. Mm-hmm. One, two, three, start. Let's try to walk. Want to see you walk a little bit more, okay? Try. No. Okay, what? 1, 2, 3, and so. Okay, turn around for me.
When asked to turn, he hesitates, appears to be somewhat stuck to the floor, and takes a series of very, very tiny steps to pivot in place.
I recommend him that what will be useful for him to have a laser pointer in his hand and to point the red laser onto the floor to initiate his gait. That would be a good trick for him to use. Yes, please. Yeah. Sometimes listening to the music that gives the signal, that's helpful too. Okay? Now when you want to start, I want you to try to point the light onto the floor. I know that this light is not very strong, so...
Get me confused.
Okay, turn around now.
At another time in the
back.
exam, he actually exhibits a fairly brisk gait until he comes to a stop and attempts to turn, when once again he develops freezing and a series of very small steps.
Try again. Keep trying.
In this portion of the clip, he's holding a pen light in his right hand, shining it on the floor and attempting to provide himself with a target that he can step over, which is not particularly helpful.
Okay, if you...
In this case, he's being given a
Good.
target to step over, and each time this is provided, he steps quite nicely and then generates a very brisk gait down the corridor. Once again, a single step over an obstacle and he's on his way.
That's
Pull testing is done here.
Okay, now weight yourself, okay? Weight yourself, turn up before, okay?
And he's unable to prevent himself from falling backwards.